Stephen had come to us to discuss his options about replacement of his missing teeth. He had been using a partial denture that was not very stable and he could not eat with very comfortably. He had lost his teeth and a significant amount of bone due to removal of a jaw cyst many years ago. The main challenge that we had was the severe deficiency of both height as well as width of bone and little to no foundation for support of the dental implants. So we managed to restore Stephen's jawbone after only 2 reconstructive surgeries and was able to develop the adequate bone necessary to support the dental implants. We also revised his gum tissue to create a better appearance as well as protect his implants. We provided him with a fixed set of teeth supported by 6 dental implants. We wanted to make sure that he has plenty of support for his new teeth and be able to chew anything he wants.
When I do presentations and meetings and such things, so that was very pleasant change. I had to get used to eating on both sides of my mouth again because I had gotten to in the habit of just eating on my left side of my mouth. So that was something you don't normally think about, chewing while you're doing it. So that was interesting. So just that I guess I've gone back to the way you normally are. You tend to eat without thinking about it. For a long time I was just very self-conscious about all the aspects of chewing and everything, and now I guess I'm gradually going back to, most people when they eat, they don't really think about eating, they just do it, and everything. So I expected to be more conscious of the fact that they're not, my natural teeth, but I really can't, day to day I don't really tell that much of a difference. So I'm pleased with that. Terrific. I appreciate especially you taking the time to explain everything. I'm an IT guy and I enjoy details because a lot of what I do is very detail oriented. So I'm very curious about how things work, and I appreciate you going into all the technical aspects of it. It's very interesting, even if it was not happening to me.
Yeah.
It's actually very interesting. I'm very pleased. Everything, considering, like you said, considering what you began with and the problems with the bone loss and all that, I think it turned out very well.
This was truly a transformational experience for Stephen, and we could not be more pleased about the outcome.